So we're going to get started. Good afternoon, everyone, and welcome to the USF Black Alumni Society and Latino Alumni Society's Summer Series. My name is Luz Randolph, and I serve as a volunteer for the Latino Alumni Society. I am a double alumna of the University of South Florida and currently serve as the Executive Director of Development at St. Petersburg College Foundation. Before we begin, we'd like to take a moment to acknowledge the protests happening here and around the country. What occurred to George Floyd, Ahmaud Arbery, Tony McDade, Breonna Taylor, and countless others is far too common and hits close to home. Like you, we are saddened, angry, and at a loss for words. However, we stand in solidarity and believe we must make change. While we cannot change the past, we can certainly influence the future. This is why we must work together to bring you programs like this one, where we provide education and resources for your engagement and that will empower you to make a difference. So let us remember, divided we fall, but united we will forever stand. It is because of the lack of education and resources available to our Black and Brown communities that our groups got together and developed this summer series. Today's topic will focus on access to healthcare and nutrition. Without further ado, I'd like to welcome our outstanding panelists, Rafael Gonzalez and Dr. Beverly Grandison. Dr. Grandison is a certified health coach and owner of Premier Health and Wellness Consulting. She is a graduate of the Florida Agricultural and Mechanical University and South University. She is a retired Army captain, lifetime Girl Scout, Rocks Inc., and a Rotarian. An impressive resume which includes educating and empowering the underrepresented populations within this market. Next is Rafael Gonzalez. Rafael is an attorney with over 35 years of experience in the healthcare, disability, insurance, and legal industries. He is a UF and FSU graduate, but has since seen the green and gold light and has been an adjunct for USF in workers' compensation, Social Security, Medicare, and Medicaid. Our third panelist, Ashanti Idolet, was unable to join us today due to an unexpected emergency. To both panelists, we welcome you and are excited to get this session to start. So I'll start with Dr. Grandison.
Oh, not a doctor quite yet. Not a doctor yet. But thank you.
I'm putting it into the...
I see that. I see that. Thank you for that.
Beverly, what is the biggest challenge in the health field at this moment as it pertains to COVID-19 in our community?
So again, I just have to thank you all, especially the Alumni Association, the university, and everybody involved in making these type of events happen, because we are definitely, as you mentioned, and I loved your intro, to acknowledge what's going on globally in the world is very serious. And so last week we had an amazing set of panelists, and next week you're going to get some more meat and potatoes. But I'm going to reiterate again what I said last week is the education. And I see you have your doctorate in education, so you know the importance of that, and misinformation. So really honing in on making sure that we get informed using reliable resources and data that will absolutely help us to not make decisions based on illogical thinking or erroneous data. So that is the biggest challenge, I think, going forward, and not getting distracted with everything that we cannot control. So we have to stay focused on what we can control, and that's getting informed by getting the education and making sure that we're using reliable sources. So those are the two things, you know, right off the bat that I can say is in my opinion, the biggest challenge across the board.
Rafael, anything you'd like to add to that?
Yes, so Thursday mornings, the United States Department of Labor puts out their weekly statistics, right? And so this morning at 8 a.m., we learned that another 1.9 million Americans last week applied for unemployment compensation benefits. Mm-hmm. When you add up the last 11 weeks, we've learned now that 42.6 million Americans have lost their job as a result of this coronavirus pandemic. These are folks now out of work, applying in a system that certainly here in Florida, for example, is overwhelmed. And so these benefits may not be forthcoming as quickly as certainly all of us would like them for these folks who need them the most right now. From an access to healthcare, what that also means, since the current system we have in place is that most of us obtained our health insurance coverage through our employer, that's 42.6 million Americans that may have lost their health insurance coverage. I say may because some folks may be able to pay the COBRA, right, premium, but normally that is such an expense that most folks who lose their jobs are unable to pay that COBRA premium. So that's 42.5 million Americans now without health insurance, added to the 20 plus million folks that we already had uninsured. So we are now currently at a point in our time where more Americans than ever without health insurance out there. So lots of statistics out there, lots of studies. I've blogged about what's going to happen to the majority of these folks. You know, are some of them age 65 and over will run to Medicare? Will some of them run to the Medicaid program, both the federal and the state Medicaid programs that we have in each of our states? Will some of them run to the Affordable Care Act and try to obtain coverage through those health exchanges? All of that is sort of in the mist and changing from moment to moment here as we go along. So to me, that's one of the biggest challenges that this coronavirus pandemic has produced is we already had an access to health insurance problem. We now have an incredibly significant, I mean, it is magnified and then some. And so talking about some of those options, some of those issues, I think is significant and important. Just like it was already mentioned, I'm so grateful and so appreciative that the University of South Florida has done this, sort of a summer series to talk about all of these issues. They're so important, and especially, you know, considering what's happening in our country right now. So I'm so grateful and very appreciative for the opportunity to be here with all of you.
And of course, we are grateful that both of you have signed up not only to do last week's panel, but this week's panel as well. I do have a follow-up question for you, Rafael, but before I continue, I want to make sure that all of our attendees are aware you're able to submit additional questions, and we will do our best to get to those questions through the chat. It may serve us better if you go through and send the question directly to Melissa Etienne. She'll be the only Melissa in that panel, in that list with 2 Z's. Easy to remember, Melissa Etienne. It'll be easier for us to capture, and we'll try to make sure to get those questions answered for you. My follow-up question to that, Rafael, is, I mean, knowing those statistics, right? How do we move forward? What are the most critical changes that we must make now so that we can effectively face the future? I mean, those statistics are astounding. So trying to figure out how to take all this information, what are some of those critical changes we must do within healthcare, but also we'll follow that up with our nutrition as well. Rafael, can you kind of expound on that?
Sure. So just to give everybody a perspective, we have before the COVID virus, right? 163 million folks that obtained their health insurance through their employer. We had about 62 million on Medicare. We had about 71 million on Medicaid, and we had about 13 million through the Affordable Care Act exchange or marketplace, leaving us with about 29 million folks uninsured. This is all pre-coronavirus, right? Nothing new here, right? We have been having this discussion for many, many years, if not, right, on an option on how to provide insurance to everyone, right? And whether you're for it or against it, and I know that there's both plus and minuses, right, out there. You know, the making health insurance available away from your employer to a system, for example, Medicare for all, or Medicare for people, after a certain age, but younger than age 65. Expanding Medicaid coverage. Generally, Medicaid today is for either the disabled or the very poor, very limited, right, assets and resources. Down here in Florida, for example, the test is less than 40% of federal poverty level. If you make a living beyond that, you're not eligible for Medicaid here in Florida. So a lot of folks have said, why not raise that bar, right? Why not make it 100% of federal poverty level? Or like the Affordable Care Act, 120% of federal poverty level. That would institute a program and a method of insurance coverage for a lot of millions of folks all across the country, and not just in states that have actually picked up or expanded their Medicaid program after the Affordable Care Act. So none of these ideas are new. They have been around for a really long time. Making Medicare coverage to a significant larger population, changing the ability to enter Medicaid, and for those folks, for example, who earn greater than those numbers, paying a premium, right, for Medicaid coverage. So there are lots of proposals on the table, lots of ideas that have been kicked around for many, many years. For whatever reason, our politicians have not gone there. I think the time that we're in today, what is happening around the country, I think it's time that we must look and act on those ideas. I think this pandemic has finally forced us to realize that the way that we have been obtaining coverage may not necessarily be in the best interest of all Americans.
I mean, just with that information alone, I wonder, as we discuss, what is it that we can do as a community, right? How do we evoke that change, right? How do we know these are discussions that are happening. We know that these are ideas that are occurring, but how do we evoke that change, right? How do we call people? Do we support or try to rally around resources or organizations that, promote that change for us? Because it's been happening for years, but now I think you bring a valuable point, and it falls onto Beverly. The pandemic has completely impacted our Black and Brown communities in a completely different way than others. So that definitely changes the way that we are looking at our healthcare and how we are looking at our health and access to health and access to nutrition. So what are some things, describe the greatest challenge we are going to be having moving forward when it comes to our health as it is impacted by the pandemic and with the information that Rafael has shared?
So good. So super statistics, Rafael, and those are the facts. And as you mentioned, Dr. Randolph, it's true. Those can just become overwhelming and depressing, right? Because then I can also add our state of affairs for our health. And of course, the numbers are probably higher for the Black and Brown community. But when you think about 1 in 4 people dying of heart disease, or 1 in 2 women and 1 in 3 men developing cancer, and that 1 in 3 will have diabetes by 2050, and that 1 in 5 children is obese, those numbers should be very alarming. And that our children are more harmed by a poor diet than alcohol, drugs, tobacco combined. So the question, or the answer to the question that you just asked, Dr. Luz, is it Luz? Because I wanted to say Dr. Luz, is it Luz? Luz. Mm-hmm. Thank you for that, sorry. So Dr. Luz is taking self-responsibility, okay? We cannot control those statistics, those numbers that are out there. They're there for a reason. But what we can control is how we take care of our bodies to put ourselves in a position to where we're not as dependent on a system, okay? And it really takes a concerted effort, as you mentioned earlier, in getting into the right communities of people that are absolutely fostering the education, because, kids are out of school. Kids might not go back to school for the rest of the year. What is that going to look like? What is it looking like right now? I just, right before this, got off a call with a client, and older, like Raphael mentioned, and I said, hey, so are you going outside and walking and getting some natural vitamin D. And she's like, well, every now and then, y'all, media is promoting more sickness than wellness. I'm sorry to say that. And I know Raphael hates when I say that and bangs the media and stuff, but look, let's get real about this thing. They spend billions and billions in advertising for a lot of unhealthy things. And there's only millions spent on preventive care. And we've got to get into the seat of prevention if we're going to head this off, if we're ever going to combat those statistics. We can't keep blaming they. And I wanted to say it last week, and I'm going to say it this week, because I went to a conference years ago, and there was a Dr. Patterson who looked up who they are, because we keep saying they said, they told me. Who is they? They, she said, are the power of everything. They thrive on ignorance and the fear of the unknown. Just drop the mic right there, okay? We cannot continue to stay ignorant, and we cannot continue to stay in fear. What we can do is do the simple steps, and I keep on saying that. I'm a simple person. Yeah, number statistics are great, but when it's all said and done, how is that impacting me and my family right now as we speak? There's been grocery stores and food deserts that's been totally damaged and closed due to all of the rioting and everything that was happening. So us talking about all of the stuff that we cannot control is important, yes, but how do we get food to these people now who can't go to a grocery store, who was not planning for the grocery store to be closed? That's access to nutrition. That's access to getting into, again, there's a lot of churches. There's a lot of churches around that are stepping up to the plate to open up food pantries. So prayerfully, no one is completely out there lost without getting access to care, and making sure that our kids are not going to really, I mean, everybody's going to suffer. Right. But we can protect our children today by making the right decisions that's going to impact them for generations to come.
And I think you brought up several valid points, but you brought up populations that are being impacted very differently through this pandemic, right? Which is the children, those who were dependent on going to school to get their meals, right?
That's right.
And then the elders who, whether it's through their SNAP benefits or through in Tampa Metropolitan Ministries or through whatever facet, they were receiving some sort of nutrition. But it'd be interesting to hear from Rafael how during this pandemic, those who are considered the most vulnerable, right, our elders, what are some key items for us who are the caretakers, right, for the children or for our parents? What should we be working on getting in order when it comes to healthcare? I'll tell you, my mother she has been a diabetic for years, but she's never had to check her blood, right? Her numbers. But now it's something that is happening. And I've noticed that through the pandemic, because she doesn't want to leave the house, she doesn't want to do anything. There are certain things that she is not doing nutritionally, right? But now as my sister and I think about all the things that we need to do, we're consistently on the phone trying to call Medicare, Medicaid, or her doctors and trying to understand what we need to do as children, as her adult children, to help her. So what are some of the things that we need to be getting in order? How do we become more informed and involved when it comes to healthcare, in particular for our parents and our children?
Luz, I love that. I mean, God, what a fantastic discussion. So about 25 years ago, for me, the reality, the awakening that there was going to be a moment in our society where we were going to have 80 million folks over the age of 65 on Medicare. And if the Medicare system is struggling today, right, and the trustees of the Medicare system recently published a study that indicates that the Part A, the hospital insurance part of it, may go bankrupt by 2026, right? Just around the corner, if things don't change. And that's because we've got 10,000 folks reaching age 65 on a daily basis in our country. You know, we've got 62 million today. We are marching towards 80 million folks on Medicare. On the other side of that, right, and we now have 40 million folks less paying into that system, even though more Medicare beneficiaries coming up every day, right? And that has been a continued programmatic issue. Less workers. At one point, we had 10 workers for every one beneficiary. Today, we're at 3 workers for every one beneficiary. We are slowly making our way onto 2 workers for every one Medicare beneficiary. It doesn't take a mathematician, it doesn't take a statistician to figure out that's a disastrous equation, right? And so the Medicare system has been looking at this issue for a really long time. I've been fortunate enough to be an adjunct at the USF College of Public Health. And that is one of the issues that I have brought to the college to say, look, lots of different systems out there are struggling with this. Not just the Medicare and the Medicaid system, but the Medicare Advantage programs, right? How can we identify these issues early on, and what can we do about them? So I like to introduce, for all of us online here today, social determinants of health, right? Health is probably only 20% medical. And I love Beverly's point, because she's absolutely on the money, right? 80% of our health is something other than going to a doctor and a hospital and a clinic or something like that. That 80% are the factors that we're talking about, right? It's education, it's food, it's transportation, it's housing, right? And there are moments and things that happen in people's lives that push or hurry that need. For example, a loss of job, lack of food, eviction, which we're having a lot of today, right? Abuse at home, social isolation because of the things that are happening. These are all proven components of the equation that push folks to a brink, right? To an emergency. So bringing these issues to the researchers. Okay, what do we do? Who can identify them? And Luz, you've already indicated, right? The individual who goes to the doctor, why isn't that doctor communicating, hey, I've got an individual here with specific needs. Let's connect her to our community. Let's connect her to the social programs that exist. Hospitals can do that. Doctors can do that. Therapists can do that. Clinics can do that. You know, the payers, the insurers are starting to do that. The third-party administrators and the vendors are starting to do that. Now, there's a financial interest for them to do that because it may mean that they're spending less dollars, right? And so there is almost a win-win, if you will. For the individual, there's connection to the community services. For the payers, there may be less expense if you can identify these things early on and get them to the right source. So to answer your question directly, and that was in 2017, I was part of that study at USF, and I think it was WellCare, which is a managed care organization that provides health benefits to about 4 or 5 million folks around the country. And that's what we discovered, right? That there are situations that abruptly, right, force people to react, and that these are things that we can identify early on if we're asking the right questions. If the doctor, the hospital, the clinic, the payer, if they know more of the social components of the individual, we can identify and then we can connect, right? So that was in 2017. In 18, we did a study that literally documented, okay, if in fact these payers and these doctors and these hospitals do that, what's in it for them? What's the savings available? And we studied several 100,000 claims and came up with about a $2,400 savings per person per year if we could connect these individuals to the right public resources, right? That's 10% savings for most insurers, most third-party administrators. You talk about an incentive, right, to identify this information and connect them to the community sources out there. And then last year in 2019, we wanted to dig even deeper. So what are those components, right? What are those items? And we discovered that foremost, right, folks need family support. We're talking about prenatal care, parenting education classes, child care, child welfare issues, right? Number two, food access, as Beverly has indicated. It is 20% of all the calls, right, are I'm having difficulty putting food on the table. I'm having difficulty putting healthy food on the table, right? Third was transportation. Fourth was utilities. Fifth was medication assistance. And sixth was housing. So these are, again, it doesn't take a brain surgeon, right, to figure out these are the day-to-day needs of our people. And when they lose a job or when there's a situation at home that makes it tough, these are the things that immediately become a need, right? There are social programs in every one of our communities out there to connect folks to help and assist with these things. But I think the number one component is identifying them and then forcing that bridge to be made, right? That conversation to be had.
I think you brought up a great, I'm sorry, go ahead.
I'm sorry, Luz, I wanna piggyback off of what Raf, because it's so, like, we're right in sync with this, right? And that's why we're having forums like this, so that we can put our listeners in the driver's seat, because it's not gonna start with them or they, okay? So Raphael has statistics and great, and they're doing the research and that's great. But where it's gonna start is on the ground with us demanding the conversation with your practitioners, with the social workers, with the school systems. That has to happen at the grassroots levels, okay? So what we do in my company is a lot of workplace wellness, because of course we're disjointed right now because we're teleworking. A lot of people, when we get back into the workforce, that's where most people spend most of their time. And if we can start educating people at the workforce on making healthier choices, then that transcends to absolutely more productivity at the work, less healthcare costs for the employer and the employee, okay? A healthier family, a healthier than neighborhood community, and it keeps going. If you understand that there was a recent study at Brigham Young University that found for every dollar spent on employee wellness programs, employers receive $3 to $4 in healthcare savings. So what Raphael was saying about that savings is huge. And my joke, of course, to all my, traditional medical world, y'all are always going to be in business. You don't have to worry that the whole world is going to wake up and decide they want to use food as medicine, and that they want to start actually getting outside, doing the simplicity of drinking more water, okay, exercising, getting the vitamin D, getting the right protein and carbohydrates into your system. That's where it starts. It does, and y'all have heard me say it before, and I'm going to say it again. It doesn't matter how much money you make or have, how much you work out, how knowledgeable you are, because knowledge is not power. Applied knowledge is power. How much church you go to, whatever. If you don't focus on your spiritual health and your physical health, nothing else matters. You're going to have faith over fear through these perilous times. But what we are here to do is to promote hope and promote connection and promote healthy communities. And as Raphael mentioned, is to making sure that these systems are in place working collaboratively. It's a holistic approach to take it. Yeah, it takes a village to have a healthy nation. And if we don't get into that mindset, and I loved what the counselor, the doctor, I forget his name. He was so powerful and basically
Rubin?
Yes, Rubin? Yeah, Dr. Rubin. He was so awesome when he said, and it seems so simplistic, y'all, and not to, minimize the statistics and all that stuff, but love does conquer a lot of stuff. And if we can get into that seat of really taking care of ourselves well, so that we can start taking care of other people well, then it fosters health, mental, physical, spiritual, emotional health will happen. We cannot stay focused on the woe is me. We have the ability to take control of what we can to the best of our ability. And there are resources right there locally for you guys. I know Pastor RJ Stevenson, New St. Paul AME, they do every other weekend a food bank. And, oh, by the way, I will be down you guys' way. I think the weekend of the 21st or something to do, he's going to be doing a ribbon cutting for a community garden. And that is something that, yes, everybody needs to show up and participate in so we can start turnkeying that system, because Raphael, that access to food, that can transform lives. When you all are talking about another study, Oxford-Durham study, where 30 days, a child being fed whole food, real food, fruits, vegetables, and berries can absolutely improve their writing, reading, and spelling. That's huge. Y'all, we're talking about impacting the next generation. That's what's important to me right now. I'm in my 50s going, but it's the ones behind us that have got to get the education to get empowered to start making better choices. We can't keep saying it's okay, it's okay, and we're still feeding ourselves the stuff that's making us sick. Raphael said 80%, and I love it. I'm going to roll with his 80 because I usually say about 75%, right? I'm going to roll with the 80 because I love that. 80% of our diseases are preventable. It is lifestyle. Let me debunk it right now, and we have the science to show. Cancer, diabetes, heart disease, all of those diseases are not hereditary. Yes, you heard me say that. Now, are you predisposed? Do you have the loaded gun to pull the trigger? My husband uses a great example, 2 twins. There's twins born from the same mother, same egg. They have 2 completely different lifestyles, and they have 2 completely different outcomes. One can be super healthy and one super unhealthy because of the lifestyle choices. So if I can't stress anything more on this platform, this forum that we have together collectively to really help people, if you're listening, reach out. I need help. Those are the actual easiest words to get the ball rolling, to get the access to the resources that are already out there. And there are a lot of resources out there that do want to help, and to make sure that we are fostering health, wealth, and that's the other thing, wealth. So finances, there's opportunities. Home-based businesses are on the rise right now, big time. I keep telling people Amazon hasn't lost any money. Their delivery schedule is out weeks, so people are still spending money. So I don't want to hear about people saying I don't have time and I don't have money, because, we make time to do what we want to do and we spend money on what we want to spend money on. I didn't even know it was true. I would like to believe it's not true, but stimulus money was going to go buy $1,200 sneakers, $1,000 sneakers. What in the world? I don't understand that. That's what we need to be talking about in conjunction to making sure that our Black and brown communities are making wise decisions, informed decisions, not based off of, as Raphael said, when you're in a crunch, you're desperate to do anything. We don't want you there. That's why these forums are being created, so that we can come alongside you to help you through the process. And Raphael has all the legal stuff right there for you. Nobody should be getting abused on their workforce or anywhere, because we do have things in place to protect you. But we have to just stay on the positive of hope.
Right. But I think you both brought up some really good points, which is one of our questions over in the chat from Lynette House, which is, how do we have people right now signed up and listening to this webinar, right? They signed up last week, they came, this week they came, but typically the people who come and get educated are the ones that are not having that lack of education. We may choose to live different lifestyles, right? We may have the access to the education. We see it all the time, but what can we do? How do we elevate this education to those who are not able to do that? And I think, Raphael, you answered it. You both answered it, which is, going into seeing what organizations are available in our own communities and plugging those individuals in. It takes the step of those who are educated to plug those individuals in and say, hey, you know, this individual has an issue with healthcare. Let me talk to this organization who does pro bono work or can educate you about it and bring your family along. Or even, you know, there's an organization here, Hispanic Services Council. I'm a board member of that organization. We provide nutritional advice to families in Waimama to say, yes, you are in a particular budget, but let me tell you, you can still eat, we say saludable, still very healthy in a budget that can still work for your family. And I think, I mean, it's a question, but Lynette, we hope we've answered it with the fact that there is a lack of education because people are choosing not to sign in. But it is our responsibility too, for those who are in the spaces, to provide that education, to tie those individuals in, to tie them in and get them to where they need to be. It is up to us, nonetheless, whether we choose, right, to take that advice and amplify it and implement it in our lives. A follow-up question was also from Joan Tucker. And I want to read it word for word. Don't forget the debilitating effects of mental health, depression and anxiety on our ability to get up and move. This affects one's ability to exercise and eat well. But before we jump into that, that's a great statement, Joan. I would love to hear from Rafael if there are any statistics or any information that you can provide on the last 11 weeks. How have the numbers skyrocketed at all when we are calling our healthcare systems for our mental health, for advice? I know that I have, for sure, have utilized my healthcare system during this time because it's very challenging. So do you have any numbers on particularly when it comes to healthcare and the access to mental health during this time?
So at least the numbers that have been published or are available are again based on the public systems, right? So Medicaid, for example, has seen a 400% request for psychiatric or emotional type situational help, right? We know, all of a sudden telemedicine, because either the inability to go visit the doctor or folks just feeling uneasy about it. So the request for telemedicine is probably now at 4,000% increase. The number one request for telehealth services is mental health, right? And where 3 months ago, Medicare was working very slowly towards creating a fee system, how to pay doctors for those type of visits. And they had been doing this for months, if not years, very slow, very, la. All of a sudden, because of this need, they've authorized it immediately. And now, just 2 days ago, right, the administrator of the Center for Medicare and Medicaid Services has announced they're going to make these provisions now permanent. They're working on federal rules of regulation. They will publish them out to the public, and they will welcome public input, because from now on, it's clearly a decided, yes, this benefits the world. This benefits our folks, right? And so telehealth, I think, is here to stay, especially in the way that it's been used here, physical therapy, certainly mental health services. There's lots of things that you cannot do through telehealth, but certainly a number of things that you can. So that to me is, it's an amazing overnight, the percentage increase in the need for and the demand for these type of services. Yeah.
So one second, Ms. Beverly. So I tied that in because I think it's important too to understand that component alone of telehealth, right, changes the scope for those families, the vulnerable ones, right? The ones within, not everybody, I want to make sure that everyone here understands, we're not saying every Black and brown person in this world has a lack of need or lack of access. That's not the case. However, there is despairing, right? There's a despairing needs across our communities. But when you talk about the access to healthcare in a way that can change the lives of individuals, because they could access information through their phone, even if they don't have a computer, or go to a space where they feel comfortable and still have access to mental health support, or a televisit about, hey, this is how I'm feeling today, so that they know where to go. I think it's so important. And I'm glad you shared that piece of information. With Ms. Beverly, I think that, Georgina, I want to tie it in because I also want to make sure that we get as much resources and information out to our panelists, to our attendees. What would you say to farm workers who live in homes with other family members, 3 or 4 families, and don't have the space to store their own food? I think sometimes we tend to forget that this is actually, well, for some, seem like, oh, that's great, you don't have space to store your food. It's not whether there's a plenty of food, it's sometimes there is nothing available for them to store food in. So what do you say to them? What are the resources available that we should be seeking out to in our communities?
So great question. And I want to go back to the question before about the depression, because I think that's important to touch upon really quickly. As a professional counselor, so we have a lot of labels that we put things on, okay? And it is, again, and I said this, I think, last week, depression is living in the past, anxiety is living in the future, and peace is in the present. And so I understand the debilitating symptoms, I guess, that depression can bring. And I gingerly and very carefully tread lightly on this subject, because again, we all make choices in life to choose how we're going to process information. I mean, I do exercises where I can literally show you how easy it is. We make choices to either choose to be happy, choose to be sad, go back to being happy again, all in a minute. So it's a choice that we make. And again, not isolating ourselves is so critical. And a lot of the elderly, that's happened. And I think that was mentioned earlier. And then just in general, we were bred for connection. We were bred for relationships. That's what we were born as human beings. And so that has been significantly impacted. Well, now that we're going into the different phases, I know this, you know, we go into phase 2 where I am, and we're opening up the phases, right? Being very aware of our surroundings is always going to be important, but also reconnecting with people. So it's good that, you know, we can give money to charitable institutions, and that's great, but it's about us getting on the ground and actually getting into the communities to actually show them how. So the how. We do things like once again, we're opening back up the phases so people can start meeting again together. But we do sound the jar parties, which are community-based things to show people how economical and affordable eating healthy really is. That's the how to do it. A lot of people already know what to do. It's the how to do it. We're doing, again, that community garden with New St. Paul and AME to have them grow their own food inside or outside without soil, without a lot of heartache, so that they can control their food source and that they do have fresh food that they're actually they have access to. And then farmers markets. The farmers markets are going to be coming back open. The co-ops. We had to look at those and start really supporting those big time so that you can have access to fresh food. And then overall, just gardening. Just you have some land, or you just have a space or some pots. Start putting some things into some pots and, you know, growing food so that you have access to food. I think that's going to be important as we go forward. And then I keep saying, simplify life and make sure that we are protecting and educating our children to make healthier choices so that they can have a healthier immune system to weather whatever is to come. And when you feel better internally, guess what? You feel better physically outside, you feel better mentally, you feel better emotionally. Churches are getting reopened. Get back into the community of people that are positive and that are going to foster a healthier, future as we go forward. Being aware of the challenges that we do have, but again, focusing on what can we do and what can we control. And that's the only thing that we can do to stay in a vein of positivity and healthy mind, out of depression, out of anxiety. I hope that's making sense, because
I think it makes great sense, Beverly. I think you touched upon the fact that there are ways that we ourselves internally can make some life choices, whether we're predisposed or not. We can make some life choices to make some changes. With Georgina's question about families and farm workers, there are some limited things that they can and cannot do. However, it's bringing that education to them and figuring out the best ways with the resources that are available to them internally and externally to help them and ensure that they are still getting the proper access, not only to nutrition, but also to mental health care. I want to make sure it's 12:50 and we have 10 minutes and we have great questions. So I want to follow up with, what is one piece of practical advice you would give to someone wanting to improve their health? Something you have not mentioned. I'm going to give you a minute, Beverly. Something you have not mentioned. What is one piece of practical advice you can give to someone wanting to improve their health?
I think I've mentioned it all, to be quite honest with you. But one practical where I start everybody, well, I have to say 1.5. Okay, so you have to give me 2. Start drinking more water. That's the first thing I tell everybody. Okay. A 7-day water challenge, get your urine almost clear as possible. And the number 2, I mentioned it last week, watch the movie Forks Over Knives, get the education. That's the practical, one simple change that you can do to actually start improving your health outcomes. And after you start doing that, you're gonna wanna go further, you're gonna wanna learn more, you're gonna wanna eat more fruits and vegetables, berries and grains. Luz, that's the best I can tell you, just to keep it simple. I mean, that's where it is. Start there.
Well, I think, one, I challenged Miss Lynette, didn't think you could do it under a minute. She did it. You get a star for that. But the next question is for Rafael, and it's sort of in the same realm. I want to know, what are some key areas of vulnerability that our community faces in understanding healthcare? Because I think once you highlight what those areas are, then we know what we need to do to educate ourselves. So maybe it's just one. I'll challenge you as well with a minute. I won't start the clock until you say a word.
Man, this is going to be tough. So this pandemic has shown us who is really significant and important in our economy. Essential workers, right? The folks on the line, the folks working with people every day, despite everything that's going on around us, we're putting them at risk. Employers are putting employees at risk. And to top it all off, most employers and most of their insurers are denying the workers' compensation claims arising from COVID exposure. We have to change that. We have to push and we have to challenge that. That cannot be happening. These are our new heroes, right? Police officers and firefighters and folks that work at the grocery store. We have to do better. There is absolutely no reason, if we're putting these folks on the line, why their workers' compensation claims, if they're infected with this disease, that they're not being covered. So to me, that is one of the things that I am personally working on, trying to educate employers and carriers, insurers, third-party administrators. Governors are forcing the point. Some governors are signing new laws to make sure that these on-the-line workers are being covered. Insurance commissioners around the country are doing the same thing. State legislatures are amending their laws. And I know I've gone over the minute, but it has to be done, right? It is so significant because, to bring it back home, the grand majority of these folks are Black and brown community members, right? And so if we don't take care of them through the workers' compensation system, then we're leaving them on their own to take care, and that's disaster for families. So
so I don't want it to sound like just complete disaster. Again, we can do things to mitigate, the disaster. So really quick, because I want to make sure this is on recording. Again, influenza has killed more people to date than COVID has. Last year, the year before, it wasn't a pandemic. If for some reason you were to get COVID, a lot of times, most of the time, you're probably not going to die. You're going to feel probably yucky, okay? But if you put your body in a position to be able to fight, you're going to have a better outcome on the other end. So I do want people to understand that, yes, COVID is out there, but it is not something. Be mindful, follow the rules of your state or whatever, which is important. But we do not need to be walking around in fear, thinking that if somebody coughs or breathes wrong, that, oh my goodness, we're going to get infected. Okay, so please be mindful that do the things that you're in control of, and to be, because there's a lot of misinformation still coming out about COVID transmissions and all that stuff. That is paralyzing people. That's what's keeping people in fear and paralyzing them to not make the right decisions. We cannot control that stuff. Again, I'm going to stress, let's take full responsibility for what we can be in control of and make sure that we're doing the right things.
And I think, first of all, I think the information you provided, whether you went over your minute or not, Rafael, that's fine. But I think it's important to note, because each of us, whether you're on the panel or you're an attendee, you may have some sort of influence that you may be privileged of having, or may not even know that you have. So understanding the education, understanding where you are at, and how to navigate these tough times, because they are tough for everybody, regardless of who you are. But for our Black and Brown communities are especially tough. It's important to maintain a good outlook, but maintain the education, figuring out how we can deliver this education in the best way possible. I want to thank the both of you for the time that you have given today, and not only for the time you've given today, but the time you gave last week, the time you will continue to give to us. For our attendees, we want you to know that we will be sending a follow-up email thanking you for your attendance today, but also providing you resources that our own panelists have shared with us about ways that you can get educated, you can get involved, or resources that they go to find out more information, whether it's related to COVID or related to their own particular line of work. I want to thank everyone that attended today. Thank you for spending your lunchtime, because I'm sure some of you were spending your lunchtime with us. And if you didn't, I grant you time to go eat lunch now. We are appreciative of your time. Thank you to the USF Alumni Association for allowing us to gather together, to providing this space for us. So needed during these times, but especially now with everything else going on. Again, thank you. We appreciate you both immensely. We'll be sending you some gear. Bill doesn't know that I just said that, but we'll send you more USF gear. Thank you all. I hope you have a fantastic rest of your day and week. And as always, go Bulls.
My sister is a Bull. She's a graduate.
Have a great day.
Thank you all so much. You guys have a great day.
You too. Have a great one.
Thank you.